Hey guys, and welcome back to the Holistic Rehab Room. Today we're going over patellofemoral syndrome. What is patellofemoral syndrome? Patellofemoral pain syndrome is a broad term used to describe pain in the front of the knee and around the patella. It is common in people who participate in sports, but it can also occur in non-athletes as well, and it's usually behind the patella. The epidemiology. It occurs in 15 to 45% of the population. It is common in women and athletes, and it increases with age, most common in those between 50 and 59 years of age. Etiology. So it can be due to overuse, patellar malalignment, or muscular imbalance or weakness. For overuse, vigorous physical activities that put repeated stress on the knee, such as jogging, squatting, and climbing stairs. It depends on the frequency, duration, intensity changes in exercises that can also cause this. Use of improper sports training techniques or equipment, as well as changes in footwear or playing surfaces. For patellar malalignment, we have abnormal tracking of the kneecap in the trochlear groove, and the patella is pushed out to one side when the knee is bent. This increases pressure between the back of the patella and the trochlea, irritating the soft tissues. The problems with alignment of the legs between the hips and the ankles. Muscular imbalances or weakness, especially in the quadriceps. Let's go over the signs and symptoms. So you may have a dull aching pain in front of the knee, and it begins gradually and is frequently activity related in one or both knees. You may have pain, so pain during exercise activities that repeatedly bend the knee. You may have pain after sitting for long periods of time with both knees bent. You may have pain related to changes in activity level or intensity, and you may also get popping or cracking sounds in the knee when you're climbing the stairs. Medical management. So the surgical procedures are arthroscopy, as shown here. I have inserted a photo from the Orthopedic and Sports Medicine Institute 2024 that shows the arthroscopy procedure. And then we also have realignment. So for arthroscopy, the surgeon inserts a pencil-thin device equipped with a camera, lens, and light, the arthroscope, into the knee through a tiny incision, and it is used to remove cartilage fragments. For the realignment, this is usually in more severe cases, the surgeon may need to operate on the individual's knee to realign the angle of the kneecap or relieve the pressure on the cartilage. Management. Medications. So there's over-the-counter pain relief, acetaminophen, which is Tylenol, as you can see in the photo right there in the center. And then you also have ibuprofen, which is known by its generic name Advil. Next, we have management physiotherapy. So phase 1, which is in the first 72 hours, you want to do injury protection and pain relief, which is PRICE. So protect, rest, ice, compress, and elevate. Then we can do some passive range of motion, lateral and medial glide, and caudate and cephalic glide. So up towards the head and down towards the feet. Exercise, so you can do a VMO stretch, which is the vastus medialis oblique stretch, or you can do the ITB stretch, which is the iliotibial band stretch, and you can do some half squats. Electrotherapy, such as TANS and inferential. And these are my references. Thank you guys for tuning in. I hope you learned something. If you have anything else to add, you can add it down in the comments. Please like, share, and subscribe. Thank you very much for watching. See you next time.